Hello and welcome to this online presentation in which we will run through the first two steps of the EBM process, that being using PICO to structure an answerable clinical question, and secondly using our PICO mnemonic in order to search the medical literature both effectively and efficiently. So these are the steps associated with EBM. As mentioned, in this presentation we'll focus on formulating a clear clinical question before we move on to searching for the evidence. So you might be wondering why we've got a picture of a lady here advertising a particular product, and the reason being is even though we're going to be using the PICO mnemonic, it's something that we're already actually doing as our part of our daily lives. So if we were to look at this particular advert, we could possibly ask three questions. Who are the advertisers targeting? What is the product that they're selling? And what is the outcome of the product that they're promoting? So in this case, we might state that they are targeting women. We might put a specific age on it, 20 to 40-year-olds or 30 to 50-year-olds. The product is this particular cell renewal cream, and the outcome has the promise of firmer skin, looking younger, feeling happier, etc., etc. So the anatomy of a good question, as mentioned, is what we term the PICO mnemonic. So our patient, our intervention, our comparison, and our outcome. So for each of these components, we want to make them as specific as possible. So when we talk about our patients, not only do we want to know the age and the sex and the particular exposure or clinical characteristic of interest, we want to make it as broad as possible, which will hopefully assist us in our second step, searching the literature. Similarly, for our intervention and comparison, we want to make this as specific as possible in the sense that we want to identify what the intervention, exposure or comparison is. We want to think about aspects around dose, duration, frequency, those sort of aspects as well. And in terms of outcomes, not only do we want to focus on one primary outcome, but a lot of times we might also want to include secondary outcomes of interest as well. So what we might do now is go through a clinical scenario and then use this scenario to base the rest of the presentation on. So George is an active 83-year-old male. He lives in his own home and still drives a car. He has had pain in his left knee when walking up hills or climbing stairs over the past couple of years, but not frequent and severe enough to see his general practitioner. Several days ago, he developed more severe pain in his left knee, making it hard for him to walk to the shops. He came to the clinic because he is planning a car trip. He doesn't want the knee to interfere with his trip. So the doctor examined him and requested a plain x-ray of the knee. He then made the diagnosis of osteoarthritis and gave George a corticosteroid injection into the knee and asked him to return after his trip to begin a course of physical therapy. Now George has had physical therapy before for his back and he's very skeptical of this suggestion. He wants to know whether there is any proof that physical therapy does any good for this problem. So using George and our scenario, we can come up with our PICO. So our population being elderly patients with osteoarthritis of the knee, our intervention being physical therapy, our comparison being no treatment. In this particular scenario, we've got no treatment, but we could very well have other treatments. So it could be NSAIDs or any other comparison that we may be interested in. And our outcome being mobility, pain relief, quality of life, etc., etc. So when we go to structure our answerable question, we will be using all components of the PICO framework. So our question from our scenario is, in elderly people with osteoarthritis, can exercise therapy improve comfort and mobility? So now that we've got our question, the next step is to search the literature. So we have a lot of pyramids in evidence-based medicine, but this pyramid relates to searching the literature rather than the evidence pyramid. So down the bottom we've got studies, and the reason why we've got it down the bottom is because simply there's a lot of studies out there, both including randomized controlled trials, cohort trials, case control, opinions, comparative studies, etc., etc. Then what we have are a synopsis of studies. So this is where databases such as ACP Journal Club, which provide a summary of let's say an RCT, become useful. From there we've got systematic reviews, which again are another form of synopsis, albeit a more detailed form, in which a systematic review of the literature is undertaken. So all relevant studies are identified, critically appraised, and then a meta-analysis, if appropriate, is performed. Going on from that, we've got synopsis of synthesis. So quite often our systematic review will be quite lengthy and time-consuming to read. So this is where databases such as, again, ACP Journal Club may come into effect because they provide a nice synopsis or summary of our systematic review. And then up the top we've got, again, further summaries of these information sources using databases such as Best Practice, Dynamed, and UpToDate. So in conducting a search of the literature, there's really only a few commands that one needs to know in order to effectively and efficiently search the relevant databases. Two concepts which are essential, and that is to understand how to use and or in constructing a search. So when using and between two search items, so something like hypertension and pregnancy. So let's say this is hypertension, this is pregnancy. By using the and command, we are only going to get these studies, that is those studies that contain both hypertension and information relating to pregnancy. Our or command expands our search. So this is what we want to do or want to use when we're looking for synonyms for our particular items. So if we're looking at, let's say for example, outcome in terms of our PICO structure, by typing in high blood pressure, we would find all of these articles. Hypertension would find all these articles. By combining the two searches with our or, we would find articles that relate to hypertension or blood pressure. A couple of other, useful things to know. Using quotes assists in searching for phrases. So if you wanted to exclusively search for high blood pressure, using the quotes would find that particular phrase. And truncation, so whether it be with a star or a dollar sign, is also very useful. So in this example, we've got pregnant, or pregnan. Using the star sign, we would identify pregnancy, pregnant, and other variations of that. The other final tip is that it is always useful to use the limits function. So whether it be limiting your returns via the type of publication that you're interested in, or the type of or a particular year that you're interested in, let's say from 2005 onwards. So over the next few slides, I'll just run through a couple of databases. The first being BMJ Best Practice, and this is a really useful tool to get a good overview on a particular clinical condition. So in this case, we've just typed in osteoarthritis, and it's led us to the osteoarthritis page. So it provides both a summary and an overview. So this is just the summary. So it provides information on history and exam, diagnostic tests, treatment details. And then if we want really specific information, we've got the relevant tabs up here in which we can identify that. So whether we're interested in the epidemiology, the pathophysiology of it, looking at prevention, looking at diagnosis, so looking at history and examination, differential diagnosis, looking at specific guidelines, and then all the variants on treatment in terms of emergent therapies, guidelines, evidence available on specific therapies. So as you can see, a very detailed information source that provides both answers to both specific and broad questions on the topic. The second database that we'll talk about briefly is the Cochrane Library. So the Cochrane Library is a library that houses Cochrane reviews or systematic reviews. If you're searching the Cochrane Library in Australia, the Australian government has made it free, so we can freely access all Cochrane reviews and PDFs of those reviews. So if we were to just type in a basic search in the Cochrane Library database, and this is accessible on the first screen. In this case, we've just typed in osteoarthritis and exercise, and if we press go, we will be able to identify the results returned. One of the good things about the Cochrane Library is that it almost forces you to search according to your PICO structure. So if we wanted to add in another comparison, all we would need to do is click on this plus button, and we would get another search term, which we would then type in there, and then we would use our ands or ors as appropriate. So now that we've just done this basic search, we can identify that there are 46 Cochrane reviews or 46 systematic reviews on osteoarthritis and exercise. So like I said, we can make our question as simple or as detailed as possible. So if we just quickly run through some of the returns, we've got, for instance, aquatic exercise for the treatment of knee and hip osteoarthritis, acupuncture for osteoarthritis. If we scroll down, we've got this one fairly broad review, exercise for osteoarthritis of the knee, which in this case may be exactly what we're looking at. The last database that we'll talk about is Medline. So there are two versions of Medline, Ovid Medline and PubMed. Now PubMed is the freely available version of Medline, which is freely available via the internet. When I say freely available, that is freely available to the public. Ovid Medline is limited to university and hospital staff, so if you're a student or clinician, you will have access to Ovid Medline. As mentioned, they are both accessing the same database, that being Medline. They're just two different interfaces. The difference being that with Ovid Medline, it provides a link to the PDF of the article, which is freely accessible most of the time, whereas PubMed does not. So just to get familiar with the Ovid Medline interface, we've got our keywords and our other options up the top here. We've got this space in which we put our search criteria, and then we get our returns down here. Now the one thing to highlight is when using Ovid Medline, always make sure that this box is ticked, that is that map to subject heading. So the mesh or the map to subject heading box basically acts like an index within Medline. So much like the yellow pages, if you're interested in having some sort of fast food for the night, you pick up the yellow pages, go to F for fast food, identify fast food, and then within that identify what type of fast food you wanted. broadly speaking, this is the same principle in which the mesh term or map to subject heading term works. So enough talking. If we run through our examples, so the first thing we would want to do is type in osteoarthritis, which we'll do, and the next slide we'll see what. So typing in osteoarthritis leads us to this particular screenshot now. So as you can see, these following underlined or hyperlinked terms are our mesh headings. So when we type in osteoarthritis in Medline, it says, okay, do you want to get articles in which we've indexed under osteoarthritis, or osteoarthritis of the hip, or osteoarthritis of the knee, or spine, etc., etc. So in this case, we've identified that we're happy with just the general selection of osteoarthritis. What we could also do is run a keyword search. So if we tick this box down here, we would identify a keyword. So the difference between a keyword and the mesh heading. A keyword will identify the term, so in this case osteoarthritis, anywhere in the article. So whether osteoarthritis appears in the title, the abstract, within the article itself, or within the references, it will pick it up and identify it as a useful article. Conversely, using the mesh heading, so using this term here, we will only identify articles in which osteoarthritis is deemed to be a primary information source. So it's the primary outcome in which the article is based on. If we wanted to, we could also click on osteoarthritis. Then this would provide us with further details in terms of where osteoarthritis and the term fits within the Medline database. So as you can see, if we click on it, we go to this page and you can identify that it's a subset of osteoarthritis. So we've got different variations on that. And once again, there are these other subsets of the osteoarthritis mesh term itself. So in this slide, we've searched for both osteoarthritis using the mesh heading, but what I've also done is search for osteoarthritis as a keyword. And as you can see, if we limit it only to the mesh term, there's 28,000 odd articles returned, as opposed to when we perform a keyword search of osteoarthritis, in which we get 51,910 articles returned. So we'll run just a simple search in this case. So we've identified our patient. The next thing to do is to run our intervention. So the first thing that we might do is just type in exercise. So again, typing in exercise, we get this scenario in which it's picked it up as both a mesh term as well as a keyword. Rather than going through the whole process again, what we can do is just click on both of these items, so both exercise and exercise as a keyword, and then within the database itself use our OR command and state that we're happy to pick up articles that talk about exercise as a mesh heading, or mention exercise as a keyword throughout the article itself. So moving on here, we've got our intervention, in which we've said that we're happy to identify articles that are placed under the mesh heading of exercise, or under the keyword of exercise within the article itself. As mentioned, we might want to come up with various alternates to our intervention. So in this case, we've typed in physical therapy as an alternative to exercise down here. So by clicking on or entering physical therapy, we've got two scenarios. So within the mesh terms itself, it hasn't come up as a mesh heading. So physical therapy hasn't, but these variations on it have. So physical therapy modalities, physical therapy specialty, etc., etc. So once again, what we've been happy to do in this case is state that yes, physical therapy seems to be closely aligned with physical therapy modalities. We'll highlight that, and we'll also click physical therapy as a keyword. So now we've got essentially our search completed. The first thing to do is to clean it up a little bit. So we've got our patients and we've got our intervention. We haven't got a comparison because our patient scenario was George, who had osteoarthritis of the knee and was just interested in the effectiveness of physical therapy. We haven't got an outcome measured because we want to keep our search as broad as possible. If we get too many returns, we can always put in outcome, whether it be pain, quality of life, as another term in which we could reduce our search results. So the first thing we want to do is group our terms together. So in this case, we want to identify all articles that mention osteoarthritis or osteoarthritis as a keyword. So what we've done is just click these two boxes here, and what we'll do is use the All button to combine them. So combining them, we've identified 51,910 articles. So basically, it's predominantly all these articles in which the osteoarthritis as a keyword was selected. That also seemed to engulf all of the mesh terms of osteoarthritis as well. So similarly as we've done with our osteoarthritis, we want to combine our exercise or physical therapy modalities secondly, and then once we've done that, we can combine both our osteoarthritis and our intervention aspects together using the AND. So in this slide we've got our patient and our intervention combined, and we've got our final results. So rather than going through all those results, what we can do in order to limit the number of articles that we need to go through is use this additional limits button up the top here. So by using this additional limits button, we can limit it according to a variety of characteristics. So if we're interested in particular ages, in this case we've highlighted middle age, all age and age over 80 as our particular limits. We've limited it by language, so we're only looking at accessing journal articles that are published in English, and in this particular case we're looking at randomised controlled trials of interest. So if we combine those limits, we can see that we've limited our search results quite dramatically, and hopefully we'll only have a page or so of abstracts, or in case even if you just wanted to browse the titles to identify whether or not we've got a suitable randomised controlled trial in this case to answer our question that we identified earlier. Thank you for your time, and if you have any questions, please feel free to email me. Thank you.